health resource is open in Westfield, aiming to expand access to treatments for those struggling with depression and other conditions. Keta Medical Center recently celebrated the opening of its newest location, bringing physician-supervised ketamine therapy to the community. Co-founder and medical director, Dr. Haviva Malina, joins us to talk about it. Good morning, doctor.
Good morning.
So now I know a lot of people are going to hear ketamine and they say, that's cat tranquilizer. It was human tranquilizer before it was cat tranquilizer. I'm tired of people, like during the pandemic, they love to say anything that was used in animals, that it's an animal, whatever. It was used in us first, right?
Right.
Am I correct? All
Correct.
right.
Correct.
So just to make it clear,
That's right.
and ketamine
Yeah.
it helps people with their psychological challenges very much, apparently. So talk about how this works.
Sure, absolutely. So as you pointed out, ketamine has been an anesthetic in humans for decades and decades, and more recently has been shown to have this new use, and it's shown to be very safe and effective to treat depression, in particular depression, where people have tried other types of treatments, other types of medications, either plateaued with them or had side effects, and then they come to ketamine and it can really change things for them. It's also used for PTSD and anxiety. So it's sort of this old medicine with a new use, and it's really works wonders for many people.
What was the impetus? How did they first determine that it has the secondary use?
Right. So it's always been used in higher doses for sedation, anesthesia, and then about 10 to 15 years ago, they started to study it in lower doses. They would give it to patients actually in the emergency room for pain and for for very severe depression that brought patients to the ER. And then that sort of triggered a whole lot of more research being done in this field. And the literature has really exploded in the last 10 years to the point that now the nasal spray called Spravato, which is S-ketamine, is actually FDA approved and has been for 6 years.
Oh, that's an interesting way to get that uptake, is through the nose, as opposed to having to take a pill.
Yeah.
Which do they even have a pill of ketamine? Is that
So,
an option?
so there are pills. There are some issues with the pills because those are at-home treatments. So they're you run up against safety issues when you take things at home unsupervised. The types of ketamine at Keta Medical Center that we offer is IV ketamine, like the infusions, as well as the FDA approved Spravato. So that has to be given under doctor supervision. So at our centers, which I think is something that distinguishes us, is that there's always a doctor, a nurse, making sure everything is safely given in one of our centers. So Westfield is actually our newest center. Our first center that I opened 5 years ago was in Oradell, but we've expanded in the New York area since, and we're so happy to be, open now in Westfield also. And we're open on the weekends and the evenings. So people do have to come into the office, to the center to get the treatment, but it is something that we try to make accessible and affordable for our patients.
And that's a good thing, because it forces the patient to check in so that the medical professional can see how they're doing. Pardon me, aside from receiving their treatment of ketamine, they get to ask questions. And how are you feeling? Is there anything more you want to
Right.
talk about? Is there anything more you need? How is this treatment working for you, et cetera, as opposed to just giving them pills and hoping they take the right dose of pill at home. Or, as we know, many people with depression, not many, but some do skip their meds, and that could be an issue. So this way we know they're taking them. So who is the typical candidate for this type of treatment, doctor?
Right. So, people come to us for many different sort of avenues and for different reasons. Sometimes, they've been on medications, for years, antidepressants, anti-anxiety medicines, been struggling with PTSD. And, they just haven't moved the needle in some of their symptoms in a way that they hope to, or they've sort of felt like they've plateaued, but they haven't kind of had that breakthrough of sort of feeling present, feeling motivated, not just mood and feeling lighter, but just sort of of feeling more joy in their day to day. And I think that's where ketamine comes in for many people. Others can't tolerate the oral medications. Sometimes sort of the medicine was worse than the problem for many people, where they have such bad side effects that it's not worth it for them. So there are many people come to us from sort of many different reasons, and we will, if they don't have their own psychiatrist or therapist, they can see our in-house ones. But most of the time, people come with their own providers. And one of the things we like to do to sort of offer this comprehensive care is, I personally will do the consults with every patient, and I will touch base with their psychiatrist, their therapist. Very often people have multiple providers, and I will make sure everyone's on the same page. We will keep them updated. So we're sort of an adjunct to people's care, mental health care, and we try to work with them to sort of achieve their mental health treatment goals.
You are the physical therapist to the orthopedic surgeon. How's that as an analogy?
There you
Right?
go. Great
So
motto.
you work
Great
hand in
motto.
glove. See that? You're a hand in glove. You could use that, by the way. That's yours. It's all yours. So the beautiful part about this is you emphasize that physician supervised care, and we often hear also about treatment resistant depression. So how significant is that issue today? And is ketamine the answer to that?
Yeah, so I mean, have found, these are studies published that are verifiable. 30 to 40% of people that are on antidepressants still have symptoms, do not have symptom relief. So that means that you kind of think that you're prescribing an oral medication and then the problem is taken care of. But first of all, it's a dynamic process. Different things work at different times. Life changes, everything is sort of a moving target. But more than that is that our brain biochemistry shows that ketamine works in a unique way on the brain. And it kind of creates these new neural connections. So people sort of colloquially talk about, recircuiting the brain, but there is some grain of truth with ketamine, that there is this concept that these new pathways are created. And that is what helps a lot of people kind of make a dent in their, what we call treatment-resistant depression symptoms. For many people, treatment-resistant depression can mean just simply that they are not sufficiently treated. Maybe they had a partial response to their oral medications, but they want to see more. And for others, it just means that they have tried every medication in the book. And so we have a gamut of patients coming from sort of different places and really finding ketamine very helpful in their own individual way.
Doctor, what's a website for more information?
Yeah, absolutely. So it's www.ketamc.com. That's Keta Medical Center. So it's ketamc.com. And, you'll get set up with a consult with me. So I do all the medical intakes, and we'll talk about the options and, what makes the most sense for you.
Fantastic. Keta Medical Center's newest location, Westfield, New Jersey. Co-founder and medical director, Dr. Haviva Malina. Thank you so much for coming on this morning. Best of luck with the new center.
Thank you for having me.
Thank you.